We're learning more tonight about the need to halt pay raises expected in April for Baystate Health employees. I sat down for an exclusive one-on-one conversation with President and CEO Dr. Mark Kerouac to find out why.
The pause in this raise is something we really did not want to do. We did it with, a great reluctance, but it's part of a whole package of trying to get our finances back online.
Dr. Mark Kerouac, Baystate Health President and CEO, tells Western Mass News the hospital system lost about $177 million in 2022, $63 million in 2023, and $10 million so far in 2024.
The pause on wages, on the wage adjustments, is part of a long laundry list of things that we're doing, including working on length of stay, working on schedule optimization, working with our vendors on their rates, renegotiating some of our managed care contracts, all of a whole package to get our finances back in line.
Kerouac tells us this will not apply to contracted employees as their salaries are agreed upon with unions on a 3-year basis, indicating they are ineligible for the annual increase to begin with. But the paused rates do apply to his leadership and executive teams at Baystate Health and is a result of the current state of hospitals.
Before the pandemic, we were a very stable organization financially.
You don't think bankruptcy is in the near future for
Absolutely not.
Dr. Kerouac admits that Baystate Health has dipped into reserved funds, about $200 million, but they still have $350 million they can access if the situation deteriorates. He tells us every hospital is dealing with the same desperation in the post-pandemic world.
Even across the state, many hospitals have declared bankruptcy. Some have been in financial distress and have asked to be acquired by larger organizations. Some have cut services. Some have done layoffs. We're nowhere near having to consider that.
Kerouac points to selling properties in recent years as a way of maintaining financial stability, but stresses that bankruptcy is not on the minds of leadership at Baystate Health. Additionally, pausing the annual pay increases has allowed the organization to avoid their other option of laying off 150 people. It's a tough decision many hospitals are faced with in today's world.
I would say that the outlook for hospitals, according to the official rating agencies like Standard & Poor's, is not good. They gave them a so-called negative outlook, meaning that they're not optimistic about their finances.
Kerouac tells us that Baystate Health properties do $6 million of work every day. And with a Western Mass medical giant showing weaknesses, can patients still have faith in their quality of care?
I'm not concerned about that any more than I'm always concerned about that. I always think about that, but I'm not worried that we're losing ground there. If anything, the numbers would suggest that we're doing better.